Hey everybody, it's Kurt from 410. It's Tuesday, May 19th. It's our weekly update for the country of Guatemala. We have the great and awesome Amy Todd with us. How you doing, Amy?
Good. How are you?
I'm good. I'm good. I'm good. Thanks for taking the time to help me update everybody on what's happening in Guatemala. Why don't we start with what's happening countrywide? I know there were some changes last Friday, and so give everybody kind of an update on the kind of countrywide situation in Guatemala.
Sure. Right now, as of yesterday, there were 1,737 active cases, recorded 138 recoveries, and unfortunately 35 deaths. And we're fortunate enough right now where we don't have the virus in any of our communities that we work in. However, it has gotten a little bit closer to our San Martin communities. We just were notified that there was a case that was identified there, which is probably closest to the Chapila and El Rosario communities there, maybe a 15 to 20 minute trip. So it has definitely gotten closer, but still not in the community.
Okay. And I know there was a change, kind of what the government stance was late last week. So tell everybody, it's a little bit weird. So tell everybody like what's happening around curfews and what the government action's been.
Yeah, so over the past couple of weeks, the president had started relaxing a lot of the restrictions. And I guess last week they saw a sharp spike in cases, around 300 plus, and he reacted very quickly and had a press conference last Thursday night and announced that they were shutting everything down for the weekend. People were only allowed out for a few hours over the weekend through Monday to get some groceries, just because he had given them no advance warning of what was happening. Moving forward, right now, Monday through Friday, things will be opened up. The curfew has gone back from 5 p.m. to 5 a.m. Yeah, 5 p.m. to 5 a.m. You have to stay off the roads and in your homes, but you can move around during those daytime hours if needed. However, for the weekend, so starting 5 p.m. Friday night through 5 a.m. Monday, complete shutdown. No one should be allowed out. So it's kind of a sharp contrast from where they were headed to things being more relaxed to being shut down again.
Okay. So basically, the weekends, the whole country shut down.
Yeah.
24-hour curfew. Wow.
Right.
Okay. And what's the situation currently in our communities? You said that some of the, or in San Martin, Chapila, and El Rosario, within a 15, 20-minute drive of there's a confirmed case. What's happening out in the Wayway communities, and what's the general mood, I think, of our communities these days?
Yeah, I mean, I just got off the phone with our Guatemala staff, the 3 guys that I work with there, and you know, they're on the phone constantly with the leaders in our communities, and morale seems to be doing okay. People aren't as concerned about the virus, maybe as other places. The identified case in San Martin was a nurse that had been working in a healthcare environment somewhere else. And so it doesn't have the feel of this community spread outbreak. That nurse is in quarantine. So once the word about how that case came about was identified, there's not panic going on in the communities. And that's, I would say that's in Western Highlands. You know, there's not a case nearby any of our communities up there. And I think people are just trying to go on about their business as best they can with all these restrictions.
Yeah. And so tell us also about the people that in April, we had distributed food kits to a 2-week supply of food kits to the most vulnerable. Tell me how they're doing, when the next round is scheduled, and if anything's happening specifically with the vulnerable families in our communities.
Right. So you're right. The first distribution was about 2 weeks supply of food. That has lasted longer than a 2 weeks. And so, first of all, those families very appreciative. The leaders in the community very appreciative of what we're trying to do there. In talking with the staff this morning, we're targeting another distribution the first week in June. And we'll go back to those families because they were identified as the most vulnerable and still have needs. And then we may be looking at some additional people that have been identified. It seems that the more vulnerable are further out away from the center of activity. And so, as days go by, we may become aware of some additional people that we just weren't aware of before.
I got word of I was told about a child, a special needs child that that's sponsored and goes to the rehabilitation center. Can you give people an update about their family? I know they're getting a little bit of a special attention now. They've had a tough go of it. What's the story behind that family?
Yeah, so actually this is in the community of El Pajal. It actually isn't one of the special needs sponsored kids. It's just a regular student that is sponsored there. That family was already in a vulnerable situation, and the father has passed away in the last several weeks, which places them even more vulnerable, as he was the main income generator for them. The community, thankfully, has reached out to help this family. Specifically, there was a storm that came through, and the house wasn't very sturdy anyway, and it got kind of blown to pieces. So, and with the rainy season coming, we want to make sure that they have shelter and then identify some other needs there. But yeah, that's just an example of, a family that's in a vulnerable situation and has had, some negative experiences through this whole thing that we're trying to help.
Right. Well, I'm glad we're helping. And so I assume local churches are involved in that. Yes. Leadership councils driving that effort. Yeah, great.
For sure.
Before we wrap this up, just curious if there's any other information you can share about Guatemala, maybe foreshadow, if you can, even about what might be coming down the road, or any word from the guys on the ground that they might want to share.
Yeah, in talking with them this morning, it's very hard for them to predict. First of all, they explained that people throughout the country are a bit confused because of the president's actions, and his changing of his mind really quickly. And they're just, people are just confused as to what he's trying to do and why and how. Some people may or may not agree with it also. So it's just hard to kind of predict what we're going to be able to do, with the government reacting the way they are. Like I said before, I don't think, based on what the guys are saying, that there's panic about the virus itself. It's just people are trying to, figure out ways to survive this lockdown and shutdown of their normal lives. And our desire is to help the most vulnerable. The guys want to do, like I said, the next food distribution, because with the supply chain closed down and markets closed down, that's definitely a need. And that's kind of where we are right now. I mean, the staff is very, very appreciative of what 410 and our partners have been able to do so far. And they're frustrated a little bit. I think that they can't do more, be out and about and do more and be more involved in our communities. But they're on the phone a lot. I'm talking with the LCs. The LCs seem to be doing well. They're communicating with us, very proactively if something comes up, and the communities seem to be doing well.
Great. Well, Amy, thank you. I just send our appreciation to Felix and Carlos and Liliana and Jeremy. We're just grateful for them. Make sure they get word back from us that we're grateful for them. And thanks for everything that you do. And if you'll come back next week to give the update again, that'd be great.
Okay. Thanks.
See you.